Good morning, everybody. I hope everybody's having a great day. We are coming up on the end of July. We've really kind of pounded on a lot of paperwork, whether it be contracting, certifying, doing AHIP certifications, carrier certifications, all of these other crazy things. And that's not even including your health and life licensing and all of that. And a lot of these things we've been working on with an eye towards we are going to be selling in AEP, okay, which is the annual enrollment period. But I want to stress to you all that right now, if you finished your certifications with a carrier, you're able to sell right now. So while we go out and we're reaching out to these folks and talking to them about their needs and so on and so forth, we need to also understand we could be making sales today. So I want to talk a little bit about special election periods in the Medicare space. One of the major differences that you all have versus life insurance is in life insurance, you literally have all year long to sell a product. There is not an election period that is a yes or no. But just like employer insurance or individual insurance under an ACA plan or something along those lines, there are specific times of the year that each individual can enroll in Medicare. So the key word there is each individual. Okay. So we're going to teach you not just how to sell during AEP. That's been the talking point that we've been talking to over and over and over again. But we also want to teach you to sell year round. Okay. So let's talk a little bit about that and how that works a little bit. We're not going to go way down deep in the weeds. There are tons of special election periods. So this is just kind of a brief overview, get you kind of comfortable with understanding SEPs, get you also comfortable with understanding how to get to these SEPs. Okay. And SEP is Medicare jargon for special election period. Okay. So I apologize for throwing out all of these letters, but in Medicare land, it's alphabet soup. So let's talk a little bit about what an SEP is. Okay. SEPs are time frames that are outside of your initial or general enrollment periods when an individual can sign up for Medicare. Okay. SEPs occur during specific life events or circumstances that happen to an individual. Okay. We'll kind of go over some of those here very shortly. This is going to be a relatively quick presentation, so please feel free to ask any questions that you may have at the end. This is not a super hard concept, but we're just going to kind of move through what we've been talking about and into opening it up a little bit more to give you all some opportunities to sell now rather than waiting until you're making your first sales in January. Okay. So the most common uses for a special election period, or most common uses of election periods, are when you're first eligible. Okay. That's when you're first becoming eligible for Medicare, whether that's turning 65 through disability or enrolling in a Part B plan. Okay. So this is when you're first eligible. Those are typically either IEPs or ICEPs that you are using to put somebody either on a drug plan or a Medicare Advantage plan. You will use this during your Medicare supplement choices, but these are more geared towards a drug plan or a Medicare Advantage plan specifically. One of the things that we have been talking about and repeating is AEP, or the annual election period. That's when every Medicare member, regardless of how long they've been a Medicare member, how long they've had a plan, so on and so forth, that's when every Medicare eligible person has an opportunity to make a change. And that change will go effective the first of the following year on January the 1st. Doesn't matter what day of the week it is. Congratulations, January 1st, your new plan goes effective if we sold you with the election period of AEP, or the annual election period. Okay. So those are the ones that we most commonly see. Those are the ones that everybody kind of talks to, so on and so forth. But we don't have all of the information. Okay. So how does somebody qualify even for a special election period outside of, hey, I just turned 65, or hey, this is my opportunity to buy October the 15th through December the 7th. Okay. So if you're reaching out to your clients right now, how do we know if they even qualify for an election period? Okay. Qualification depends on a specific life event that has happened to that person. Okay. Sometimes you're going to need qualifying proof of that event. It just so happens I last night got qualifying proof of a low income subsidy application from one of my clients. That initiates a election period. I'll get into that in just a second. But if the carrier comes back and says, hey, I need the paperwork that says this man is eligible for this election period, that's why I have that paperwork that came from the government. Okay. The timing and the duration of the SEP can vary based off of the SEP and the event. Okay. So we'll get into that in a little bit as far as eligibility and how those work. I'm not going to get way down in the weeds because that can make this a very long presentation. And I don't want to make it a very long presentation. I want to make this short, sweet, to the point, get you all understanding how this works so that you can actually apply this when you're actually making your sales, whether that's final expense, long-term care, or health related. Okay. You're going to have these conversations and you're going to make sure you want to find out if this person is qualifying to move them prior to January. That's what we're aiming for here. Okay. So narrowing in on an SEP, how do we do that? Well, we keep repeating time and time again in all of these trainings, you need to do a needs analysis. Okay. If you're following the steps to that client interview or that needs analysis, you're going to go through typically digging up additional election periods. Okay. If I'm asking this person about their medications and I see that they've got all of these different medications that are for chronic conditions like diabetes, if there's a diabetic plan available in my area, I've got a chronic condition. Okay. If they're telling me, oh, yeah, I struggle with paying for my medications and the government helps me pay for my medications, there you're buying me a election period. Okay. So as you're going through the process, just have the conversation, but open your ears to what could be a sale today, not a sale tomorrow. Okay. So let's talk about that a little bit, but keep that information organized. As you've heard me talk about, reach out to your clients now, do the needs analysis on them now, right? Because let's just say there's not a chronic condition plan for diabetics available in my area, but I keep a little list of these are the people that are diabetic. And then there's a plan that becomes available and it's a better opportunity for them. Boom, here you go. I've got a solution to your problem. So keeping this information organized, it's important to do the needs analysis, not just for the warm up, not building the camaraderie and not getting the information for the sale, but applying that information to what it is you need to do to make yourself effective, not only for an enrollment period coming up, but potentially another election period that we may need later. Okay. So make sure we're understanding how we narrow in doing that needs analysis that we have been talking about over and over again, how that will breed into, oh, here now is an election period for me. So now instead of making a sale and waiting on a commission for January, I'm going to make a sale and get a commission in August because today's July 30th. So I've talked to this client. They have an election period. I can use it now. I can write their application today. And on August 1st, they have coverage. So that's why it's very important to understand how these work. So let's talk a little bit about the top 10. All right. We're going to got a David Letterman top 10 of what these are. We'll go into eligibility a little bit on the next slide on these top 10 and how these work. Okay. But I want to make sure that we are talking about these so that you're kind of already in the mindset that they're going to probably find. Okay. Now, there are multiple SEPs. This is just a handful. Okay. So if somebody says something that is a life event that has altered their lives in some way, shape, or form, we need to make sure we understand how that works. Okay. So let's talk about some of these top 10. Okay. Loss of employer coverage. I retired. Okay. Gaining or losing eligibility for either Medicaid or your low income subsidy that helps with your drug coverage. Like I said, I just got a letter last night from my client. Hey, here's my low income subsidy letter. I've bought myself an election period. So today I'll send him the application and on August 1st, he'll have coverage. Otherwise, he'd have to wait until January. Okay. Is this client on a Medicare Advantage plan? If they are, there's a Medicare Advantage OEP or open enrollment period. We'll talk about that on the next slide a little bit as well. Has this person moved recently? Yes, they moved from one zip code to another. Do they have a new set of plans? New county? Something like they don't have to necessarily move from a different state. If they move from one county to another, they qualify as changing of residence. So if you have a lot of realtor friends that sell to 55 and up locations, you need to network with this person, because every person that they sell to a 55 and up community, here's your new home that you can move into. It's low maintenance, da 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 da. Here's my business card. They're handing out business cards for the key maker and the plumber. Why can't they hand out your business card? Because they now have a choice in their healthcare to make a change. Okay. I believe there are about 7 plans in the country currently that are what are considered 5-star plans. The best options you can get. Okay. There's a 5-star plan available in your area. You can sell that, market it, and use it as if it was an annual enrollment period year round. We'll talk about that in a little bit. Natural disaster or emergencies. These are starting to pop up more and more frequently. Okay. Sometimes it's a natural disaster. Sometimes it's just a societal emergency, and the governor declares a state of emergency for X, Y, and Z. Most of the time when that happens, FEMA responds, and therefore there is a natural disaster or other federal or government emergency that can kick in an election period. Okay, so if you have a bunch of hurricanes that hit Florida right in September because it's hurricane season, and people don't make their elections during AEP, October the 15th through December 7th, because they're rebuilding their houses, they're putting roofs back on their heads, right? When they get around to January and February, they still haven't made their choice. So now you have an election period because this person lived in a disaster area. Okay, has this person left long-term care? Okay, if they've entered or left a long-term care facility, they earn an election period. Okay, have they been released from incarceration? That's either long-term prison sentence or just short-term. As long as their address has changed to an incarcerated situation, now they've come out, now they've had an election period. Were there changes in the Medicare contract? i.e., is this plan underperforming? Did Medicare take the contract away from the company? Is there a plan exit? Those types of things. Okay. Sometimes those things happen depending on where you are in the country. And then employer group health plan changes. Okay. Everybody just went through a bunch of health plan changes because most employers and groups make their choices in June and July, and their election period is off kilter from the rest of the Medicare, because Medicare's election period is October the 15th through December the 7th. Well, if I sign up for new employer insurance that's no longer creditable by the government standard, I'm going to get a letter. And now my health plan change isn't good enough to be good enough for Medicare. So now I've got to switch it. So now I've got to switch to a Medicare plan. Those are some of the top 10 options that happen every day in the Medicare space. Okay. So let's talk a little bit about what causes each one of these to kick in. I'll slide through these as fast as I can to save time, but here's your top 10, and this is what makes you eligible for them. Loss of employer coverage or union coverage. You've retired, or the company just stops offering employer coverage. A change of residence. Moving out of the current plan service area. Okay. Long-term care facility. You've been discharged from a skilled nursing facility or a long-term care hospital. That happens to a lot of seniors. Eligibility for Medicaid. Have you been qualified or disqualified for Medicaid here recently? If so, now you have an election period. Same as being released from jail or prison. Long-term or gaining or losing extra help. Okay, this is a drug coverage. Extra help, or LIS, is a federal subsidy to help you with your drug coverage. Medicaid is a state program to help you with your medical coverage. These are 2 different programs run by 2 different people. Okay, so you could have LIS but not Medicaid. So understanding that, I've got 2 different election periods here, depending on what my client needs analysis told me. Okay. Switching to a five-star plan. I don't even need to hear any election period reasons. If I've got this plan in my area, once per year, at any time of the year, I can take somebody from a MedSup and a PDP and drop them into a five-star plan. Okay. Have there been changes to the Medicare contract, such as termination or consolidation of plans? If those things happen, that gives them an election period. Employer group health plan changes, we talked about those. Natural disasters, that's a situation where this person lives in an area where the government has declared a state of emergency. If that tripped over an opportunity for them to make a selection and they did not do it, then now we have an election period that we can use later in the year. And then finally, Medicare Advantage OEP. And this is where I want to stress a little bit. I need you all to start understanding. I need to move some of my clients before December 7th. Those are MedSups and the PDP folks, because they will run out of election period on December 7th unless they qualify for one of these special election periods. Now, the folks that are on Medicare Advantage plans, they have from January 1st to March 31st to try out their new Medicare Advantage plan. And if they don't like it, they can make one change. They can go back to original Medicare and a PDP, then go to MedSup and a PDP, or they can switch to a different Medicare Advantage plan, but they get one election. Okay. So understanding, hey, I've got all of these people in a limited amount of time. Because in life insurance sales, you all have all day. There is no election period. I'm not going to run out of time. But I need to create the urgency that I need to line up these people in the right amount of time and get them sold. Okay. Now, some of these folks I can take care of before we get to January 1st. So we're going to talk about these election periods. There's other people I can't handle until January 1st because they don't qualify. There's not an individual life circumstance that makes them qualified for an SEP. Not just these 10, but any of them. If that's the case, then I need to make sure I take care of them during my AEP opportunity. And once that AEP opportunity is done, I'm not done selling. Whoop, sorry, I went backwards. Didn't mean to go backwards. So understand that only about 50% of all of your sales in Medicare space are made during that annual enrollment period. We've been pounding and pounding and pounding on AEP. You need to be ready for October the 15th. If you're already ready, you can start making sales today and start pushing out your information to line up these election periods so you can sell year round. Okay. So when we talk about going out and doing these needs analysis with our clients, a good understanding of these sales opportunities and a really good needs analysis will have you selling year round. So, I get 50% goal during AEP, I still have 9 months of the year to nail this other 50%. So organize your client, do those needs analysis, and understand where your clients are. Because this will extend your selling opportunity and make you a machine that sells year round. I've got agents that sell 10 apps, 7, 8, 10 apps a month and never make an outbound call because they work their book of business. They get referrals out of their book of business. They understand the special election periods that are available to them, and they pick up business year round, not just during the annual election period. So if you have questions about which ways to use special election periods, or, hey, does this person qualify? You can go to Medicare.gov. You can contact your upline. You can contact me. You can contact the carrier support, the producer support line of whatever carrier you're trying to sell. Hey, United Healthcare, has this person's low-income subsidy been used for this quarter? Well, no, it has not. You can make them effective for 8/1. Perfect. Or yes, it has. You can't use that this month. You'll have to find a different election period. The carriers can see which election periods have been used and which ones haven't. So maximize that. Understand that. Go through your needs analysis with your existing clients, with your new clients, and keep your ears open to understanding that selling this Medicare product is really a 50-50 opportunity. 50% of your business is going to be done during the AEP. The other 50% of your business is going to be sold during the rest of the year. So I know we've been talking about and pounding on kind of just go through, do your certifications, do your AHIP, get your health certifications done, so on and so forth. I want you all to understand how these special election periods work. Because while you've done all of this hard work and you've put in the blood, sweat, and tears to get to this point, if you talk to somebody that has an election period today, you can make a sale for August 1st and start making commissions now. Are there any questions about that that I can answer for the group? Please understand that each election period is going to be based off of the individual. Those election periods will be based off of the individual, and it will be based off of their individual circumstances. Each election period has a different duration. Okay. I didn't want to get down in the weeds on how each one is a different length of time and so on and so forth. But understanding the Medicare system, understanding you have these special election periods will keep you selling all year long and make you a much more efficient and much more opportunistic salesperson in this space. Any questions that I can answer before we end today? If not, I will take that as Paul did an excellent job. I appreciate your time, and I look forward to seeing you all making some sales August, September, October, November, and December. Thank you very much. Y'all have a good day.